All right, who is Roy? Other than just this fabulous, amazing person that I have had the opportunity to work with on so many occasions. Roy Reyes, pronouns he, him, his, is the prevention manager at the Texas Council on Family Violence in Austin, Texas. Roy has worked extensively with victim, offender, and prevention programming service providers on best practices, advocacy, and facilitation. He has worked in the movement to end gender based violence since 2002. Wow. RIA's current areas of expertise are on issues related to developing trauma-informed prevention practices. That's why he's here. He's the bomb. Understanding the impact of technology on prevention and intervention advocacy, which is such an important and critical intersection, and engaging men to end gender-based violence and effectively serving LGBTQ populations. Joy, thank you so much for offering to pour into us and share your expertise with us today. Take it away.
Thank you so much, Arlene. This is a privilege to be here in this space that NRCDV has cultivated with these amazing folks from the Southern region. I am super humbled to be here with you all today and exploring this important facet of our work. So yes, we're going to talk about being trauma-informed. I refer to myself as a facilitator in that the folks that are in this room, I'm really going to look to you to share your voice, to share your perspectives. Being trauma-informed is a multifaceted task that requires a lot of different elements from our work, our personalities, from our communities to engage to truly be effective in this framework. So we're going to talk about all that today. I'm going to ask your opinions on a lot of things, and we're going to leave here this space, 15 hours for the hour, after having assessed our own trauma, our own work, and our own kind of strategies in becoming a trauma-informed, resilience-based preventionist. So again, that's what we're here to talk about. I'll go my screen if I want it. Okay. All of these friends. Okay, here we go. We'll take it. Okay. Do y'all see my video screen at the top? Y'all do. Okay, let me move this real quick. Okay. So like Arlene said, my name is Roy Rios. I use he, him pronouns. I am the prevention manager at the Texas Council on Family Violence, lovingly referred to as TCFV. For those of you who are not familiar, we are based in Austin, Texas. The council, TCFV, we are rooted in promoting safe and healthy relationships. We do this in a kind of three-prong approach, and that's really summing it up. But essentially what we do is we work with supporting service providers, we facilitate and develop strategic prevention efforts, and we create opportunities for freedom from domestic violence through our policy SSP, support to service provider department, and our prevention departments. And so those three-prong approaches, our work is geared at doing just that, which is creating healthier spaces in Texas. We do that through a network of our over 100 family violence programs, in addition to many other allied professionals that intersect with our work, not to mention our battery intervention work that is really pivotal to the work that we do in Texas and in prevention in general. So we're here to talk about the elephant in the room, which is trauma, which is something that everybody in this space is navigating in some way, shape, or form. So first and foremost, please take care of yourself. This activity may be triggering in some way for some people. I absolutely recognize that. Part of this is a lot of being trauma informed is really having that personal inventory. And I'm going to ask for you to tap into some of your perceptions around what it means to be trauma informed, what it means to work in certain communities. And so please take care of yourself. We realize I'm guiding this conversation with this understanding that collective trauma is real. Us advocates, folks who, as Joyce calls it, boots on the ground folks, you all are experiencing trauma both as individuals and as professionals. And so I just want to acknowledge that out the front. And so a lot of this is geared at you being able to think about this personally, and how do you operationalize some of these strategies that we're going to talk about. So why do we even need to talk about trauma informedness? This has been a catchphrase for quite some time. Being trauma informed is nothing new. There are copious research articles that outlined the effectiveness and the positive outcomes that can be garnered from engaging a trauma-informed framework. I would love to go into a lot of those research articles with you. If you're curious about any kind of research or anything, let me know. I'd love to follow up with you and kind of share with you some of my best thinking and resources around there, which I will do at the end. But ever more present is this understanding that as a global community, as a nation, we are navigating simultaneous pandemics. It's not just the impact of COVID-19, but we're also facing the impact of the historic systemic racism that is occurring in all of our communities. And specifically, what we're thinking about is how this systemic racism has affected our BIPOC communities that exist in all of our various communities. What we also see is that right now, risk factors are high. There is high levels of isolation in our communities. Violence has been ongoing. There are research studies that are beginning to emerge that are pinpointing that violence, IPV, has actually been rampant during the COVID-19 pandemic and subsequent lockdowns that we've experienced. We know that poverty is at an all-time high because of the economic destruction that has occurred during this pandemic. And overall, we see that there is disunity in communities. This is being manifested in our social media accounts. This is being manifested in one-on-one relationships that we're experiencing in our communities. But nevertheless, these risk factors, while they are prevalent and they are real, these issues are not things that our communities have not weathered before. So thinking about all of these issues, we can kind of think about what have we been navigating in our own kind of chronosphere. So kind of drilling down a little bit more when we think about the inequity that exists around healthcare access. Access to healthcare coverage for uninsured and underinsured families is a prevalent issue that communities are facing. There are so many healthcare disparities that we're seeing in our work, specifically that are impacting communities of color. We're seeing in some communities lower vaccination rates or lower screenings of other sickness that is generally, it's normal for us to understand that some communities of color may be a little apprehensive in engaging in some of these health promotion activities. Let's also explore the pre-existing social determinants of health and other related chronic illnesses that lead to the vulnerability of our communities who are navigating COVID-19 and also the systemic racism pandemic that we're seeing in all of our communities. Many of our partners, many of our friends, survivors in general, are maybe navigating low-wage employment that doesn't allow for work from home or even an adequate implementation of physical distancing. And overall, we see that there is a lack of sick leave benefits. And then we also can kind of think about the digital divide. Many of us have been able to go to the internet, log on to Zoom, and connect with our peers. Digital access is not a norm necessarily in many of our communities. It is a privilege. And so with all of these dynamics at play, what we see is that there is an ever-present need for there to be trauma-informed spaces, specifically in our prevention work. So trauma and the brain. Let's just have a really quick just overview of how trauma impacts individuals as they're navigating communities. So we can sum this up in four kind of sections. So we've heard this, the fight, flight, or freeze response. There's also this fourth response of fawn. So you could see manifestations of trauma experience like angry expressions, a need for more control, explosive behavior, bullying in young people as well. Some people may be more focused on school and work because they feel like they can actually affect that. So in some ways, they may have to ignore a lot of the other things that are going on in their life because they feel like they just don't have control over that. Overthinking, a difficulty sitting still. So, which is a really interesting thing because as preventionists, we're often in school-based communities. I remember as a young person, you really have to sit still. You really had to have this level of social decorum when engaging in a classroom, and there's a lot of reasons for that. But nevertheless, this idea that you have to sit still in a classroom and not, move your body can be really difficult for some people. So we see perfectionism as a form of how trauma can manifest itself. Difficulty making decisions, disassociation, numbness, being a people pleaser, lack of boundaries, and so on. What we know about trauma is that while we've been able to kind of identify these four different categories, trauma can manifest itself in very, very unique ways in the life of a survivor. And so while it's important to understand the impact of trauma, we also have to understand that trauma can be manifested in so many different ways. And so by being trauma informed, you're really engaging a framework that allows you to be really flexible in how you respond to your participants, and we'll just call them participants. While the majority of people I think engaged in prevention are working with young people, I mean, we're really kind of working across the board in terms of working with adults, working all along the life course, essentially. Viktor Frankl, an Austrian neuroscientist, coined this phrase that says, an abnormal reaction to an abnormal situation is actually normal. And I love this phrase because essentially any manifestation of how a survivor or how you and I are going to react to the trauma in our lives is normal. So if I'm really upset and I'm acting, I'm being aggressive, that could be a normal manifestation of my trauma. If I'm kind of sinking into my own self and I'm not able to connect with others, that could be trauma. Maybe I seem completely normal. Maybe I can speak correctly, I can go to work every day, but yet when I'm at home, I'm experiencing mental health issues that I am not feeling comfortable sharing with people. That's normal. So being trauma informed gives us this opportunity to meet people where they're at, to meet people in a space where they can truly get the support that they need. So being trauma informed essentially means providing customized support to our stakeholders, to our participants, to our coworkers, and even to ourselves in many ways, as we'll discuss a little bit later. As I mentioned before, our responses to our communities must be multifaceted. We're going to really, as a movement, have to balance both recent and also past trauma that individuals have been experiencing. What we know for sure is that recently, people have been experiencing quite a bit, not to mention the loss and grief that people may be experiencing, both from losing loved ones, maybe losing their career, their home. I mean, there's so much that people may have lost. part of this customized support is engaging an intersectional framework as well. So when we say that, what we're thinking about is how, when we meet an individual, let's say this person is a BIPOC person, maybe they are Hispanic like me. If you're working with a Hispanic individual, something that you're going to have to think about is what are the various forms of intersecting identity, the various forms of oppression that you're going to encounter when you're engaging with this person. And then how do you then take that understanding and operationalize that into creating a safer space for that individual and also for the other people in your space? So, and then lastly, a part of that, what I will say is it's also about understanding your own blind spots and how to fill those blind spots. And that's why we're here essentially talking about trauma, being trauma informed, because essentially we're thinking about how we as individuals can make or break that engagement by being trauma informed or not, by triggering our participants and not creating space for them to debrief about those experiences and so on and so forth. But let's take this a little bit deeper, if you will. So a trauma-informed framework can also be used to develop overall trauma-informed systems of care. And we know that this is particularly important because of the ongoing racial bias and discrimination, and then therefore the intergenerational transmission of that trauma on our communities. So something to think about. As we are focused on today in our work, in our town hall, we're really looking at the impact of racial injustice. And so part of this trauma-informed framework that we really want to center is how we engage that framework so that we can undo oppression and systemic racism in the lives of the people that we serve. Now, as I mentioned, many of us are engaged in schools, school-based prevention work. And so I want to zero in a little bit on school-based prevention work and kind of why we should even be thinking about it in that framework. I mean, aside from kind of the standard of that young people are going to school and they are in need of spaces that are not going to put them in more danger, we know that schools specifically are a key entry point for mental health services and assessment of trauma. But what we also know is that many teachers, other school staff, parents even, are not generally sufficiently trained on trauma-informed care. So I want to put that out for you because as we're thinking about the communities that we serve, we really want to be mindful about what do they need to become more trauma-informed, to engage that trauma-informed framework in their school campus, and how can you, as a resource from your organization, provide this kind of training, connecting them to other trainers in the community that can provide this kind of support. So really thinking about who needs customized support, not just my participants, but what are the other stakeholders that may be in need of this type of support. So I've said a lot. I've said a whole lot as of right now. What do you think? Any thoughts on how you would define trauma-informed prevention? I would invite you to come off mute. What's come up for you so far? Are you thinking about trauma-informed, being trauma-informed, and what does that mean to you to engage that in your prevention work? Thoughts from the audience? Any thoughts? Anybody have ideas on how you would define trauma-informed prevention? And, you know, go ahead, Arlene, please.
No, I was going to say I am off video because my connection is unstable, but if folks, we are being discouraged to use the chat for accessibility purposes, but if you do drop it in the chat, I will read it aloud for you, Roy.
Thank you, thank you. And I have the chat open too, Arlene. So yeah, if you do drop it
Okay.
in chat, I can certainly bring those voices into the room for anybody who needs to hear those specifically.
Okay.
Marcella, I saw you come off. Please
Yeah.
share.
Well, first, thank you so much for this presentation. It's amazing. And I think soy una convertida already, right? Like, como dices, ¿sabes el dicho de los chicles Adams? Oh, sorry, I'm
No.
speaking too fast.
No.
Como es como le quieres vender chicles al señor Adams. So maybe that's how I'm feeling with this. I'm just really excited because every time more I see the importance of really connecting with people from this place where like literally how we say it, where they are, but this is the real path to know how to connect to people where they are. Because if you just say it like that, it can stay in a phrase, but it's people don't necessarily know how to get there and what to do to get there. And if we start recognizing the people that come to us, especially those with those trauma features that you've shown of freeze, flight, fight, like you can, if you start recognizing those characteristics more and more, it's easier to find a way that the person will understand you. So it's just a gift what you have just shared with us. Thank you.
Thank you so much, Marcela. I appreciate that so much. And you brought up something really important. We say that all the time, meet the person where they are. And often, like, when I first started this work, I was like, meet them where they are, meaning, go to their community, or if they are, I don't know. I just had it like this very like positive framework in my mind about meeting someone where they are, but also that means like you're taking into account all of those intersections that they're navigating. So if they are an immigrant, if they are a woman, if they are transgender, if they are BIPOC in some way, if they are BIPOC individual, like we're taking that into my conversation with you, Marcela, for example. Like I'm going to think about that. And so if you give me something that I don't know how to do, maybe you're like, Roy, you're crazy, I don't know how to deal with you, this is triggering me. I can't react to that in a way that I feel offended, for example. Like I need to meet you where you are and think, how did I trigger you? What could I have done to support you in a better way? So that's a very rough example in the moment, but I definitely feel you and I appreciate what you said. Allison shares in chat, they do not have a mic, so she is sorry. And I'm sorry if I'm using the incorrect pronouns. It is important to remember that everyone processes a traumatic event differently because we all, what's my space here? Remember that everyone processes a traumatic event differently because we all face them through the lens of prior experiences in our life. It's important to refrain from judging or discounting any victim. All must be treated with respect and sensitivity. Amen. So true. Capri shares, my program is really at the point of trying to get staff in our schools to understand that the very basics of what is trauma. I feel you on that. How does trauma impact all of our students and staff, and getting them to see the benefit of using trauma-informed approaches. Capri, thank you for sharing that, because something that is very important there is that we have to bring our partners along. And those of us in prevention, all of us are in prevention for the most part, and we know dosage is key. Like people are not going to always get it in that first go around, right? We're going to have to create a relationship with these communities to ensure that we're providing them with enough space to really understand what it means to be trauma informed. As Arlene shared, I started back in 2002. So since 2002, I have been in trauma informed training, so to speak. My organization where I hail from in Lubbock, Texas, Women's Protective Services, we were passionate about engaging a trauma informed framework and would engage in ongoing training. And then I moved to TCFE 9 years ago, and I've been getting it left and right. So my dosage has been strong, but many other people still need support on getting there. So thank you so much for raising that, Capri, because it's very important. So I've already been outlining, like, why should we even adopt trauma-informed approaches? And on a side note, I'm happy to share, Capri, this PowerPoint. I have a bunch of other resources that I'm going to point to at the end. Would be happy to share those with you, and my email. I'll send you whatever I have. Don't reinvent the wheel. So just on a side note, have a lot of other stuff. So, all right. So by adopting a trauma-informed approach, we are going to be combating oppression. We are going to be actively working to undo trauma. And this is the point, is we enhance the strengths of the people in the communities that we serve while building trust, transferring agency back to our stakeholders. And our overall goal is that we're going to create safer environments. We're going to help we're going to move along our goal of overall creating safer communities. I will say that even with these reasons, we again have to examine even deeper, what are the roots of these efforts? And again, I just want to pinpoint that one of the whole goals of engaging this trauma-informed framework is that we are going to actively be dismantling racism and other forms of oppression by engaging this. When we engage in creating spaces where healing can actually occur, we can even begin to think about preventing violence in communities. I mean, we can think about this in terms of Maslow's hierarchy of needs. If I am succumbing to the trauma and the toxic stress in my life, am I going to be able to create goals for the future? Am I going to be able to think about how I, as a person, can create a safer community if I myself can't even get to the point where I feel safe, where I feel like I can communicate and be a whole individual? And the answer is most likely not. As Maslow's hierarchy of needs points to us, is in order to get to those higher levels of actualization, we've got to make sure that foundation is secure. And that foundation is really being able to navigate your trauma and be received with trauma-informed principles and experiences. So let's also think a little bit deeper around how trauma-informed spaces could affect specifically BIPOC children. So by consciously creating trauma-informed prevention spaces, what we are doing is we are disrupting something that's known as the trauma school to prison pipeline. Many of us have heard of the school to prison pipeline. This term is commonly used to discuss how young people going from the educational system to the criminal legal system. Much of this pipeline is created by imposing suspensions, expulsions, and juvenile legal system referrals. So as we engage in these efforts and bring our partners along, as you highlighted, Capri, we are working to ensure that trauma-informed principles and that framework is embedded into our school systems. We will become ever more important to us and it becomes even more important to us as we bring our partners along in this understanding. So us in Texas, we're really exploring this idea of critical race theory and what does that mean? So I want to give a nod to the amazing critical race theorists out there who are bringing us along, who are showing us the importance of this framework as we think about being trauma-informed. So critical race theorists assert that educational policy, so expulsions, suspensions, in school suspension, they operate as a function of social control and oppression. Okay, and this is backed up by a ton of research. Gilborn 2014 is just one example of that. The school to prison pipeline is a tool of white supremacy and also correlates with dropout rates and juvenile justice involvement. So something to think about as we think, why is this important? Well, because we want to help young people, specifically BIPOC young people, thrive. So examining just a little bit deeper, the function of this pipeline can be described and looked at as the criminalization of children of color. preparing them for a life of living in the prison system, and more than anything, completely obstructing their path towards higher education that's going to allow them to have any semblance of social advancement and increased financial freedom. So when we look at this, even beyond the loss of education, we see longer prison sentences for BIPOC individuals. Individuals are further penalized by losing the right to vote following a felony incarceration. Overall, what we see is that not adopting these trauma-informed principles, it basically perpetuates the traumatization and oppression of individuals and families and communities of color. And overall, what we're doing is we're keeping this power and profit of building prisons in the lap of white supremacy. And so I wanted to just go on this deeper examination because it is so important for us to think about as we're navigating these twin pandemics, specifically around racial justice, by engaging this trauma-informed framework and treating our young people and our prevention stakeholders to it, we are going to be working to liberate communities from oppression. So this is why trauma-informed is so important. I'm going to drop this in here, but also kind of move this along because we have about 15 more minutes. But how is your community responding right now? What are you seeing? It's not just risk factors. I completely want to acknowledge that. It's also protective factors. Communities have been coming together to support each other because they know that many of our systems are not doing that, right? So what are you seeing in your community? You are welcome to come off chat and share that. You are welcome to drop it into the chat. I'm sorry, you're welcome to come off mute and share. And if you drop something in chat, I will share it for anybody who needs to hear that.
Okay.
All right, so, and Arlene, I'm gonna close my chat just so that I can see my slides a little better. So if anything pops up and I don't see the little red number sign, please ping me. All right, so before we leave, thank you. Before we transition to our closeout session, let's talk about what these elements of being trauma-informed actually are. How do you tap into the resilience of our communities? So first of all, it starts with understanding, recognizing, assessing, and avoiding. We want to understand the prevalence of trauma. Capri shares that they feel they are seeing the opposite of trauma-informed responses in the community that they live and work in. Absolutely. I think, and you know, that while I don't want to make excuses for anybody, we also have to balance that idea of, is that a response to trauma? Is that a response to us as a global community, not knowing how to navigate this pandemic? And furthermore, not knowing how to navigate systemic racism. Or not listening to the stakeholders that know what to do, but just, we don't want to do it. Anyway, I say all that, it just makes me think, Capri, but you're absolutely right. I think in many of our communities, I live in the Austin community, I'm definitely seeing the opposite of many of these protective factors. I'm seeing protective factors in my various affinity groups. I'm seeing communities sharing with each other, sharing their resources and goods. But you're right, so many communities don't have a handle on this just yet. So we want to recognize how trauma impacts individuals, assessing how trauma has impacted communities, and how can we avoid re-traumatization. And I will say that with all of these suggestions, I could expand on each one of these for like 2 hours alone. So please know that this is, you know, we have an hour together and we're balancing just kind of getting all this information to you, but knowing that each one of these you could expand on and explore at length these kind of elements. So want to just kind of highlight that. Now, I also want to think about this. You mentioned something, Capri, really important around the community that you work in, the organization you work in. Are there ways that an organization as a whole could become more trauma-informed? So some things that I want to kind of pinpoint as an organization Are you building awareness and generating buy-in for trauma-informed approaches in your community? Are you supporting a culture of staff wellness? What does that mean exactly? That can be defined in so many different ways. Are you hiring a workforce that embodies the values of being trauma-informed? And are you creating safe physical, social, and emotional environments at your organization? We at TCFE, full disclosure, are actively working on creating a safe organization for everyone in our community. But it is a work in progress. And there is so much work to do. And then when you even think about the communities that we're working in, we have even more work to do in helping them come along. But we also have to bring our organizations along, because if we're out here doing all this cool trauma-informed stuff, and then we're going back to our organizations, they may be completely undoing our work. So how do you further engage in trauma-informed approaches in prevention practice? So it starts with creating safety in your prevention environments. What does that mean? What does that look like? Maybe, using making sure that everybody's placing their pronouns in the Zoom room. Maybe you are offering a trigger warning where you're explaining what you're about to discuss to allow people to have some options for themselves. Which brings me to my second strategy. Are you maximizing opportunities for choice and control? This is often known as differentiation. So as an educator, which is what we are, we're in schools, we're in communities, we're educating about people, we want to offer differentiated facilitation styles. So we want to offer audiovisual options, we want to offer engagement options, maybe even there are some lesson options that people can engage in. There are so many ways that you can engage in maximizing these opportunities. But what this does is what we see is that it fosters connection. When we meet our stakeholders where they are, and we engage in that that kind of offering them of different options, that's going to let them know you're safe. Sarah Owen is a safe person. And I said your name, Sarah, because you're like right here on my screen and I saw it. You're fostering that connect. Hey, Sarah, you're like right there on my screen, so I have to use an example. Do you have any thoughts that you would like to share in the space as I kind of tapped on you a little bit there?
Well, I was thinking that one of the ways that, because I keep hearing it, meeting people where they're at, and it's been so important to me, and I've really centered that in my prevention, in a way that I try to make when I'm out of school, K through 12, whatever grade I'm at. It's very participatory. I want the students to we're all doing an activity together. And in that, they are the experts in their experience. I'm not the expert in their experience of trauma, in their experience of racism, in their experience of, either their transness or their queerness. I'm the expert in my experiences, but these kiddos are the experts. And in reminding them of that I'm just a conduit of information. They're the experts in their experience, but I'm a conduit of information. And therefore, when it's really participatory, they're learning from each other. And they'll learn, I feel like, from each other far better than they're going to learn from, some middle-aged white lady that they really can't relate to. They can't relate to my experience. It's been a long, long time since I've been a freshman in high school. So that's kind of how I approach it, is like, you're the expert in your experience. So I have some information. Let's share it and see how we can better ourselves and our communities in doing so.
I love that so much, Sarah, because I think of young people today and how often do they get to hear you're the expert? you tell me what is right. You tell, like, I'm this conduit of this curriculum and this information, but you tell me how it applies to your life. And then we can go from there. And I
Mhm.
feel like that is so empowering for young people, because as a young person, I didn't hear that very often. I heard you need to sit down, be quiet, and learn. Essentially, I mean, not in those exact
Yeah,
words, but essentially.
absolutely.
Thank you so much for sharing that
Absolutely was
perspective.
like, yeah, absolutely. Thank you so much.
Marcella shares, I see that trauma-informed practices need to come from an authentic place because the communities have lost trust in organizations, and we are helping them and fighting for them, and they don't use the services. So important. Thank you for sharing that. Because there are so many groups, so many cultures, individuals that don't access our safe havens. Why is that? What is at the crux of why we don't get the gay men to engage in our services? Why don't we get youth? And in Texas, we have some great laws that protect youth. Why don't we have more youth knocking on the doors of family violence programs to get protective orders, to get counseling? What is at the crux of that? We all know there's, I mean, this could be a very interesting examination. Um, so, a little bit more about engaging trauma-informed prevention practices, approaches. Overall, what we're working to do is we're wanting to move away from practices and regulations that are going to silo our community-based services. Instead, we want to think about how can we promote integration of services across the board? What strategies should help structure the collaborative care and prevention strategies across sectors? Because we know in our work, so many of us intersect with such great organizations that can also be a resource. Are we emphasizing respectful, thoughtful, and consistent leadership to empower community stakeholders to act accordingly to address their specific community needs? Are we building capacity around community partnerships? Are we creating environments and relationships in schools and other community settings, even if virtual, that help people develop and sustain these trauma-informed skills? And then, as we talked about in our group already, are we then promoting those practices to our peers, to parents, to school administrators, to other community-based services? Yeah, so question there. So Allison shares, NYS Child Support is working to include trauma-informed, survivor-based responses to applicants who are survivors and what child support workers can do to make interactions with survivors more meaningful. I love that. Child support, child welfare, such a sector that needs more trauma-informed spaces. In preparing for our discussion today, and I can dig it up, I found this very interesting case study that examined, I believe it was, I can't remember where it was, maybe it was Georgia, Southern region, speaking of Southern region, that examined when they did just that, Allison, they integrated these strategies into their child welfare, just to kind of sum it up, their child welfare programming, and the outcomes that they saw were incredible, from placements being longer, from young people having access to the support they needed, and the caregivers, foster caregivers, CPS caseworkers, just being more dialed into not only their own issues, but the issues of their clients, really created an incredible framework for this particular kind of child welfare institution. And I felt like it was in Georgia. I don't remember. Just want to, before we move on from here, I want to just kind of think about from an organizational context. Are you educating about secondary traumatic stress and its impact on us, advocates? Are you engaging leadership to promote a culture of wellness? Are you incorporating staff wellness into meetings, daily life? Do you promote in-house and external opportunities for staff wellness? I just wanted to kind of throw that out there because as a movement, we really have to be thinking about how do we also, again, bring trauma-informed frameworks into our organizations? Because again, we're going to be doing all this great work, and then we're going to go back to our home organization, and it's going to be like, wah, wah, this isn't trauma-informed. This isn't good. Now, when we engage in a trauma-informed framework, the outcomes are fabulous. They're amazing. What we get is we get protective factors. We get these risk factors, we engage a trauma-informed framework, and what can happen, what comes out of that are these protective factors like communities and individuals being able to define their experiences, being able to be looked at as experts in their own experience. And that meaning something. That means you get to inform me of how I engage with you and how you engage with me. Participants are going to take the lead in prevention, which is what we want. Like Sarah said, we're the arbiters of this information, but we want you to take this information. We want you to integrate it into your life. We want you to take it out into your communities so that it can actually do something. What we see, as we talked about Maslow's hierarchy earlier, once people are safe in their basic foundation, they can then elevate to developing future goals. Overall, what we see is that by engaging these principles, by engaging this framework, organizations or individuals feel more supported by you and your organization, and they're going to look to you and promote your services in their realms, which can be essential to someone who may not have ever heard of Women's Protective Services or Texas Council on Family Violence, et cetera, et cetera. More than anything, your community will be active in their own recovery from trauma. There are no timelines, so we're going to put this formula together. And this slide is not saying you're going to immediately have these outcomes. What it means is we can get to those outcomes by being diligent, by persevering through all of the pushback we're going to get on what trauma-informed means. Many people may think, oh, that's like woo-woo stuff. That's not like real, but it is real. And we're going to be the people that are going to promote this framework, because this framework is about being effective, about getting more bang for our buck, essentially. And there are so many ways in which, for those people who are numbers and cents kind of people, that there is some great research out there that really quantifies. When you engage a TI framework, you're getting more for your money. You're getting more for the services that you're putting out in the community. In order for us to engage this framework, it's going to start with you. It's going to start with you understanding, what does being trauma-informed mean to me? What is grounding me in my prevention work? What's keeping you connected to this? Is there a story, a quote, an artistic expression that inspires you in those times of strife? In those times where communities are not understanding what it means to be trauma-informed. They're not understanding where I'm coming from. Why is this training important to you? Why did you come today? And why do you engage in this type of framework overall in your life and in your practice? What are the topics and themes that you're facilitating in your community? Are there trauma intersections that you may have been missing or ignoring because you didn't really think about it? How do these factors overall contribute to how you're showing up in your community? Somebody said this earlier, I think this was, who said this? Marcella. Marcella said, authenticity is so important, because how you're showing up, people can see that, right? Like, people can see if you're being real or not. And by showing up and being authentic, what we see is that communities are responding to that. Communities are being supported by that. So it begins with you. If we would have had a little bit more time, we would have engaged in this assessment. And this is known as TRIZ. And what you do is you kind of work backwards. So I wanted to explore, how can we create spaces that lack safety and connection, which is kind of crazy. Like, why would you want to explore that on an IPV town hall? Like, why would you even? And the point is that by us exploring, like, what could we be doing, or what do we do, or I'm sorry, what could we do to like make a really unsafe space, to lack trauma-informedness? What could we do? Make a list and then examine, is there anything that I'm doing that actually looks like this? And then you explore, what do you need to stop it? What is your first move? What triggers this behavior? This activity is such a great framework to have in staff meetings and meetings with other preventionists that you may have in your community, to just have a really rich dialogue about any lack of trauma informedness that could occur. You have my contact information, and I also, lastly, and then I know we have to go back to the main room, but these resources I handpicked because they're loaded with perceptions of why you should be trauma informed and ideas for how to become that way. Our Texas State Plan has lots of information gathered from survivors. The Trauma Informed Care Implementation Resource Center is amazing. I don't know if you've ever heard of this resource, but love them so much. Our friends at the National Center on Mental Health, DB Trauma and Mental Health. I misspelled that, apologies. Great resource. NNEDV, Prevent IPV, National Resource Center, so much great stuff. Thank you so much. I appreciate you all. And feel free to share any kind of thoughts you have in the chat, and I'll share them out loud. Basically, people are just kind of thanking me for the information, and people are grateful. Yes. I'm grateful to you all. Thank you.
Thank you, Roy. Thank you for your fabulousness. That's a word for me today. Fabulous Friday.